name is Frances Mar Diaz, and this is my psychiatric history interview for NR 548.
My name is Pedro Diaz, and I consent to this being used for the Chamberlain University reading process. I consent to it.
Hi Pedro, thank you for allowing me to do this interview with you today. And I just would like to start by gathering some basic information from you. Can you please state your full name?
My name is Pedro Diaz.
Thank you, Pedro. And how old are you?
I am 18.
Okay. And how do you identify yourself in terms of gender?
Born a male, still feel a male. So.
Great. Do you identify yourself with any particular racial or ethnic background?
My family comes from Brazil, so I'd say Latino. Okay. I don't really give off those vibes, but my name does.
Great. Are you in any current relationship, or are you married?
No, and I don't think I'd be able to give that affection or attention, even if I could be in one.
Thank you. And what do you do for work or school?
I'm in college for aviation, likely going to switch to nursing, as aviation seems to not be what I want to do. And as for work, I'm currently in the process of looking for a job.
Well, that's great. That's a great change. And what brought you in today?
How do I say it? I've just been feeling like I've felt isolated. I've had emotional mood swings and all that. Outbursts, felt sometimes insomnia, or I guess just rushing thoughts.
That must be really tough. And who do you live with, Pedro?
My mom, my two sisters, my aunt, and my uncle, and my cousin.
Okay. And I see that your vital signs were taken just prior to this visit started by the medical assistant. So I'm going to ask you if you have any allergies. It could be food allergies, medication allergies, environmental allergies. Do you have any allergies that you are aware of?
No, I do not.
Okay. And what concerns or difficulties have led you to seek help today?
I guess just this feeling of like difficulty to, I don't know, I guess start work. I've had this overwhelming difficulty to stay committed. I have these like emotional changes.
Okay.
All this stuff.
Okay. And when did these symptoms first start?
Say 5 years ago, end of middle school, beginning of high school, started quarantine.
Okay. And how long have you had the symptoms for?
I'd say 5 years.
Okay. And on a scale of 1 to 10, how severe are your symptoms?
I don't think I could give an answer. I think I'd be more biased and give myself a lower score than it really is.
Okay. Can you describe how the symptoms feel?
I have problems beginning to commit to something. When I do it, when I say something minuscule, I could try to start it, but if I don't, then it's hard for me to keep going, because if I do, then I can keep going and it's easier.
Yeah, a lot of times it just takes a little push, but I can see how that can affect you very much. And what would you say makes those symptoms worse?
A lot of just changes.
Okay.
I think schedule changes.
So you have difficulty with changes in overall?
I'd say if it's constant change, yes. If it feels like the constant change, what's not normal to me is what stresses me.
Okay. And how did symptoms affected your work, school, your relationships, or your overall life and well-being?
Well, for work, so I guess we can scratch that off. But for school, I just find difficulty in doing work. It's like difficult to start, easy to do once I get into the workflow, but beginning it is not the simplest thing. And as for like just my home life and my interpersonal relationships, doing stuff like I've had, obviously, as mentioned, mood swings and all other things like that. I think the stress from change and trying, because over the course of my life, things have been changing fast, and I think that stress has been getting to me with either outbursts on my family or other things.
It's very understanding that at this phase of your life, when you have to make a lot of huge decisions, big decisions, right? You feel that way, and it must be very hard for you. And we are here to help. So, are you currently taking any medications?
I take Adderall for my ADHD. I occasionally take Tylenol if I have like a headache or something.
Okay. And what's your dose and a frequency of your Adderall?
25 milligram, and I just take it for school. But as of late, I have been using it more for just personal things.
Okay. And have you ever been diagnosed with a mental illness before?
Well,
mental health condition before?
Yeah. I'd say ADHD, obviously, but also minor depression. I have been diagnosed with that in the past. I don't know. I don't remember exactly how long ago. It might have been a year or two.
Okay.
But I was diagnosed with it.
Did you ever take any medication for that, or?
My ADHD, I do take Adderall, as I said, but I refused antidepressants. I just didn't want to take them.
Okay. Did you do any therapy?
Once 5 years ago, middle school or start of high school, I just haven't felt the need to go to a therapist.
Okay.
Though some people say it.
And have you taken, besides the Adderall, have you taken any other psychiatric medication in the past? Or have you been hospitalized for any psychiatric reason in the past?
I have not been hospitalized for any reason, and I do not recall taking anything outside my Adderall.
Okay. And have you ever had thoughts of self-harming or harming others?
During my 5-year span of during quarantine, I'd say, I had like a minor depression, and I was very angry, and a lot of things were changing, so I was stressed and I was angry, and I did consider suicide at one point, unfortunately, and I did feel this anger, and I did want to take it out on others. I didn't, thank God, but it did sit there, and I do think about that, and it just changed.
And did you share that with anyone, that feeling with anyone, and did you have any coping strategy that you use to prevent you from going forward with your plan?
As for sharing, no, I might have shared something with my sister. She also had depression, I believe. I think we were both in the same boat. We were both stressed. I was just stressed with the changes of everything, and I feel like mentally I was not moving forward like I should have. And as for her, she was, obviously just stressed with a lot of other things, but that's her thing, not mine. And as for coping, I didn't really do anything for self-harm. I didn't harm myself too much. I have this thing on my right arm, right hand. I tend to bite it, or my index finger, or I try not to, but I did it, and I'd say, I don't know if that counts as self-harm, but I did it as as a way to deal with being stress or being overwhelmed, I guess. If I was
Okay.
Don't know too much.
So do you have any chronic conditions? Diabetes, hypertension?
Pre-diabetic.
Okay. Any surgeries or hospitalizations for, other reasons and mental illnesses or condition?
No.
No. A family history of psychiatric condition, do you know? And when I say family, I'm talking about siblings, grandparents, and parents.
I don't ask my family for their medical history. It's personal stuff, of course. But I think I've heard, just down the grapevine, I've heard like a history of like ADHD possibly, and also possibly depression and anxiety.
Okay. Okay. And as your social history, how is your daily life? Do you socialize? Do you go out with your friends? How is your social life?
My social life, well, I occasionally go out with my friends. Main reason we don't go out a lot is money, of course, and just it's difficult for us to all organize a time in which we can meet up. But I have been trying to be more social. I've tried, because like during my high school years, I was kind of pretty like antisocial, except for near the end.
And that's great, because that's a great coping skill. And continuing with your social history, what's your education level?
Well, in college, I got my high school diploma and all subsequent.
And you said you are not working, so you were seeking employment. Am I correct?
Yeah, I applied for work at a Market 82 nearby my home, and then in Ocean State that was in the same area, but they were full at the Market 82, the Ocean State. I guess I just either didn't apply properly or the website didn't list the location as needing employment. So I've applied to a fast food chain near my house, Dunkin'.
Yeah. So you just keep doing what you're doing. Sometimes getting the first one can be a challenge, but you will get there. If you work hard. And what's your living situation?
I live with my mom.
Okay. And do you have a good support system?
I have family and friends who can support me when need be. I have my mom. I have my sister who I can relate to somewhat, as we're only 4 years apart, and she kind of had some similar experiences. I have other family, and I have friends who tend to look out for me, and I look out for them. We all appreciate each other.
That's great. And do you drink alcohol, use tobacco, marijuana, or any other substances?
I've drank like on vacation a few times in places where it's legal, but as it stands, I don't really like the taste. So I didn't drink much. And as for substance use, I don't smoke. I don't smoke marijuana, or I don't smoke cigarettes. I don't have any friends who are smokers or stoners, and I don't know, maybe at one point in my life I might try, but I don't think it's for me.
Okay. And so I'm gonna ask you a few questions about your body systems. And so do you ever feel fatigued?
Like in what way?
Fatigued,
like burnout? Like
yes.
Just like not feeling unmotivated?
Yes.
Okay, sometimes, as I've stated, I believe.
Any weakness or fever?
No, I can move pretty well, I'd say.
Weight changes, skin issues such as rashes, wounds?
Not really. I've only lost like 4 pounds in a long span of time. So.
Okay. Vision changes, ear pain, tinnitus, or sinuses issues that you can think of?
I did have laser eye surgery. I used to wear glasses, but I was told that I need to have a laser eye surgery from my own mother, because she believed that if I did not get it, it would get worse and I wouldn't be able to see anymore.
That's great.
And as for like tonight, I do have an occasional ringing in my ear. It is occurring right now.
Okay. Okay. And any respiratory issues, shortness of breath, wheezing?
Not really.
No. Any cardiac issues such as chest pain, palpitations?
Chest pain, no. I think palpitations sometimes because of my meds, my Adderall.
Okay. Nausea, vomiting, diarrhea, or abdominal pain?
No. Only if I'm like sick, that's when it gets bad. But I haven't been. I only had like the flu pretty recently. That's about it.
Okay. Urinary frequency or incontinence?
No, I don't have any urinary issues.
About headaches, dizziness, numbness, or tingling?
I have an occasional headache.
Okay.
But not that frequent and not right now.
Okay. Increased thirst?
When I take my Adderall, that's
Okay.
about it.
Okay. And how would you describe your mood today?
It's all right. I don't feel too strongly one way or another. I just feel okay.
That's great. So the plan, it seems like you're using some coping strategies. You are going through a tough time of your life where there's a lot of changes, and you are trying to, get a job and school, making big decisions that will affect your life. So I would say, I advise you to continue with your Adderall. Use that for, your school, like you said, your focus to help you, give that focus and motivation. And we can follow up in our next consult if we can probably prescribe something for depression or anxiety. Right now, I don't think there's a need for it, but I would highly recommend you to explore and go back to therapy. That's a huge help. It's someone that you can talk to, express your feelings. It helps with, trauma, life experiences, depression, anxiety. That's a great tool. And exercise, eat well, build up a routine. You can even start like a little agenda of some sort and kind of, write down what you need to get done. That kind of takes a lot out of your mind and helps with, routine building. In the next section, we're gonna do some screening tools to see how the depression is. And this is more like an introduction meeting. I want to see you again in 2 weeks, and continue to use your support system. You said your sister and your mom. That's a great tool, and your friends. And I thank you for sharing your experiences with me, and I appreciate your openness. And this concludes our psychiatric history interview. Thank you very much.
Welcome.